And you're welcome. Yes, it's me again. It's time now for our health segment, and we're joined by Dr. Munisola Adanijo. She's the co-founder of Naveen Healthcare, Lagos, Nigeria, and her medical experience spans over 24 years. Today we have a very interesting topic, and we're talking annual health checks for men. You are welcome, doctor. Good to have you here.
Thank you for having me again.
Again, indeed. Aren't you excited to see that I'm the one who's having this interview with you?
Well, I was surprised.
It's appropriate, isn't it? Because we're talking about annual health checks for men.
I agree.
So who better, more equipped than that for me? I mean, all right. So, why is it important that men get these health checks, and from what age are we talking about here?
Okay, so we all need to get checked. You know, we've been talking about general checks. We talked about checks for ladies, and then today we're talking about checks for men. So every adult male needs to go for their annual physical. Okay? Because we're talking male-specific tests today, I would say once you're in your 30s, you need to start checking.
Isn't that rather early?
No. It's never early.
That is when you're enjoying your money and you really don't care about whatever it is.
That is when you need to check, when you're enjoying your money, so that whatever, if you catch anything, you can nip it in the bud on time.
Okay, that's a good way to look at it. So what are these checks that men should be aware of?
Okay, so apart from the general lipid profile, blood work, and all that we had discussed earlier, men have an organ called the prostate, okay, which ladies don't have, obviously. And they need to check that specifically because, you know, it's prone to have problems like cancer, it could enlarge, and things like that. So it's important to check.
So that doesn't happen at that age. It's something that happens way down the line. But nipping it in the bud, like you said,
early.
Checking and making sure that you don't have maybe an advent of it. But what could be the symptoms of having? Are there any symptoms?
Okay, so the whole idea is to check before you have symptoms.
Before you have.
But symptoms of prostate enlargement would include difficulty in passing urine. Okay, some people pass too much urine. Recurrent infections in men, because the prostate is actually on the neck of the bladder. It's like the pathway through which urine leaves the bladder. So if it's enlarged, it kind of blocks that. And so urine will flow freely, so there's difficulty in passing urine. And then there'll be urine left in the bladder after you pass urine. So that can be prone to infections and things like that. So it's important to check.
I have two questions now. First off, what form or format do these checks manifest as? How does it happen exactly?
Okay, so we're checking for two things.
Yes.
Now, in every man, if you live long enough, the older you get, your prostate enlarges. That's normal physiology. So you need to check for the size.
How do they check for the size?
With a scan.
A scan.
With a scan. So they do a prostate scan to check for size. Okay. And then they also check if there are any abnormalities in the texture and things like that. And then blood work to check for signs of cancer, okay, because cancer could also develop in the prostate.
Is that typically how a prostate exam happens? Because personally, and in my layman experience, from what I've heard, it involves getting probed, and that's why some people are very, very averse to it.
Exactly. So nobody likes a DRE.
An intrusion.
Exactly. A DRE is what we call a direct rectal exam.
Yeah, it even sounds.
So you can do that, but because most people are like, we just do a scan and just check.
Oh, thank you for that. Thank you. Thank you.
And you know, the scan is through the abdomen usually, unless of course there's another reason why they need to do a rectal probe. But general basic prostate scan is through your tummy. So they just check and they see if it's big or not.
That's
yes, yes.
Are they expensive, however, these kinds of checks?
Well, like I always say, cost is relative.
Yeah.
Cost is relative, really.
When you look at the long term.
Yeah, on long term. It's always cheaper to do a pre-check than to treat whatever it is that you find if you don't check.
Okay.
So.
Now, that might not be the only check that we need to do, am I correct? There might be other checks that men have to do, but on a final note regarding the prostate checks, are there habits that could perhaps maybe help one, habits that men have that could perhaps say you might not be at risk or you might be heavily at risk? What are these habits if they are?
So, habits for health are general, okay? Eat properly, exercise, don't smoke, drink responsibly, drink a lot of water.
All these have direct effect on a man's prostate.
Oh yes, on our health in general. It's really important to live a healthier lifestyle. You know, eat properly, stop smoking, drink responsibly, drink a lot of water, and exercise. Very important.
Okay. All right. Now moving on. So, are there any other checks specific for men that we need to do annually?
Apart from the prostate, not really. Not really, because the prostate is what makes men unique.
Okay.
You know, as different from women.
Okay. Okay.
So, apart from prostate checks, of course, you need to check your sugar, your cholesterol, your kidney function, and all that.
And then there's the heart as well. That's also very important.
Oh, yes, definitely, definitely. So, for the heart, you need to do an EKG.
EKG every year.
Well, it depends. If you do the first one and it's normal, you may not do it every year. Okay, but it's still important to do. Now, if you're hypertensive, you must do your EKG every year to see whether things are changing in your heart.
Okay, all right. Now, so let's go back to the prostate instance now. So suppose one goes about having these checks and discovers that they actually have an instance of perhaps maybe a cancer or any of the many things that could be discovered. What to do then?
Okay, so once you've done your test, once you do your scan, they can tell you, oh, the prostate is big, or they saw a suspicious part of the prostate. Then they would refer you to a prostate specialist called a urologist. Now, you see your urologist, and then he looks at the results and then decides what he wants to do. So if, for example, they see maybe enlargement and there is no suspicious part of it, probably give you medication and, you know, tell you to watch it and things like that. Now, if you do your PSA, that's a blood test, and it's high, and then you do your scan, and they see like a suspicious part in the prostate, they may do a biopsy to find out,
nip it. Issue.
Yeah, to find out what exactly that suspicious thing is, to make sure it's not cancer, or if it is, to know the type, to know how far it's gone, and to determine how to treat it.
So treatment would include actual removal?
Not
or
always.
Managed?
Not always.
Okay.
For prostate cancers, most of them are managed either with medication or what we call an orchidectomy, removing the. Can I say that on air?
Yeah, it's a medical, yes.
Yeah, removing the testicles.
Oh, really? It would involve removing the testicles?
Yes.
It could involve removing the testicles.
Or medication.
Oh, wow. That is scary. Let me put it so. But that's why you're here, to tell people that it's nothing that we should be scared of. These are normal checks that men, especially men, in this case, have to do, because, I mean, way down the line, you might not want to suffer what could be the consequence of not doing those checks currently. Now, we talked about expense, and you said that it's actually relative, but managing an ailment like what we've just discussed, especially at that age where it begins to manifest. How manageable is managing that instance?
So most prostate cancers are slow. Many people die with prostate cancer, not of prostate cancer. So most of them are slow growing. They take their time, but it doesn't mean you shouldn't treat it. Now, at that age, like you said, most people that develop prostate cancer in their mid to late years, most of them may be retired. That's why it's good to have health insurance. So that your health insurance can cover, if not all, but most of your bills.
Okay. Health insurance is another topic, because most HMOs don't want to insure people who are at that age. So it's very, very...
That's why you should start early, you see?
Starting early. Okay. All right. So the way you're speaking about this prostate issue now makes it seem like as if it's rather prevalent. So if you were going to give us a statistic as to how prevalent it is in maybe the African setting as against perhaps maybe other, maybe, you know, because we have different tolerance to different kinds of ailments as Africans. How prevalent is it statistically?
Well, honestly, I can give you figures right now, but it's quite common. You know, like I said, most men die with prostate cancer. Many times...
Most is worrying.
Many times it's when you are doing the autopsy. You just see, oh, he died of something else. And say, oh, he actually had prostate cancer. So it's quite common, but I can't give you exact figures as of right now.
Okay, well, but in your experience, like you said, it's something that's seen mostly in men at that age. Very concerning that. Okay, well, okay. What else do we need to know regarding prostate cancer? And also, I still go back to habits, so especially when you say smoking and alcohol and all of this, because these are not directly related to the prostate. So if you talked about smoking, I'd have thought lungs. If you talked about drinking out of the liver, so how come these are also related to prostate or perhaps the
Right.
possibility of having?
Okay, because when you smoke, cigarette smoke contains toxins, and you inhale these toxins. They don't just stay in your lungs, though. They go into your bloodstream, and they move around. Smoking has been, linked to a lot of problems, not just lung cancer, heart disease, and other issues, breast cancer and things like that. So things just don't stay where you keep them in the body.
Yeah.
Things tend to move around, okay? And then smoking also causes chronic inflammation. And then if you have inflammation, cells in any part of the body can just decide, you know what, let me stop behaving normally. Let me just start acting strange. And then when your cells start acting strange, boom, cancer develops.
Wow, doctor, you've given us men a lot to think about here today. So here's going out to all you men out there. If you're what age again? If you're past what age?
Once you're in your 30s.
Once you're in your 30s,
start checking.
It will behoove you to please start making these annual checks because you don't want to have to start treating them in your old age. Nipping them in the bud, like the good doctor has just said, is actually the best way to manage whatever issues. Thank you very much, doctor.
Thank you for having me.
Grand always having you here, and thank you for the special opportunity to actually talk about men and what we should do. I'm wondering what we're going to be talking about next week.
Next week, we should be talking about what to do when you get your tests. Because that's important.
Yeah, that's also scary. That's a scary bit. But thank you very much, doctor. And thank you for staying tuned. Don't go anywhere. We're going to be jumping back inside of the kitchen very soon in the second hour. So if you're still there, by then, you get to taste what we might be having. Kind of like taste it vicariously. We'll be back. It's Still Wake Up Nigeria.